All right. Good afternoon and evening, everyone. Thank you for joining me to discuss a topic that's quite near and dear to my heart. Certainly something that I've been doing for the last, 14 years. I'm very excited to share share some information about this topic with you and hopefully gives you some information. So I am your presenter today, Jean-Paul Lim from Ageless Living. Thank you for joining us again. And today we're going to start with our topic of our second podcast or live stream, the 4 Horsemen of Your Health Apocalypse. So here I am. For those who don't know me already, I'm a medical doctor by training at UBC, specialist in internal medicine. I'm a clinical instructor at UBC currently. I've got a fellowship in extra training, so essentially that means extra training in preventative medicine and longevity medicine. I'm also a certified neuromodulator and dermal filler practitioner. I've got 13 to 14 years of experience with complex patients, complex care patients with multiple diseases, and also in critical care and intensive care. So hopefully that gives you a background on me and helps you sort of frame what I'm going to be talking about today. So, what are the 4 horsemen? So essentially the 4 horsemen are the 4 most common diseases or group of diseases that cause the death of more than 80% of people above the age of 50. So in a more straightforward way, you can think of this as a constellation of health problems that people get, and is more likely, and it will lead to 80% of the deaths in people 50 years and older. Okay, so it's really important if you care about, trying to live the longest that you can or the best that you can. And so the 4 are, in this order, is metabolic disease, which encompasses things like diabetes, high blood pressure, high cholesterol. The second being cardiovascular disease, which includes predominantly heart attacks and strokes. The third is going to be cancer. And the fourth is going to be neurodegenerative diseases like Alzheimer's predominantly. And if you really think about this concept, if you think about the reason that we generally feel worried about aging, it usually falls in one of these 4 things, right? If people think about what they worried about that's going to lead to their death or lead to disability, it's encompassed by this. And so when you look at the statistics, because I like statistics to sort of help me frame the importance of things. So when you look at diabetes, if you get diabetes, your life expectancy decreases by 10 years. And so for the Canadians that I'm talking to, you're looking at a lifespan of about 81 years old for an average lifespan of about 81 years old for a man and about 83 for women. And so you're talking about a reduction of 10 years. That's more than 10% of your life that you lose if you develop diabetes. And that's all comers, whether your diabetes is well controlled or not. High blood pressure seems kind of benign. Don't really pay that much attention to it sometimes, right? You don't feel anything. Mine is 5 years. So like right off the bat, you develop high blood pressure. Even when you're treated, you can expect to live 5 years less than someone who does not have high blood pressure. And then there's the risk of in terms of life expectancy, but also there's the risk of, complications, which is equally as important, I would argue. And, you're talking about things like, for metabolic disease, like kidney failure. If you've ever seen someone on dialysis, it's not a pleasant thing. Limb loss, neuropathy, which is nerve pain or nerve issues, and then cardiovascular disease. Okay, so those are the consequences of metabolic disease. Then when you get to the second of the 4 horsemen, which is cardiovascular disease against stroke and heart attacks, stroke and heart attacks. If you develop asymptomatic heart disease, as in like you have heart disease, but you don't actually have any symptoms like heart pain that people usually think of, like angina. You're talking a reduction in your age, in your life expectancy of 8 years. Okay. If you actually have a heart attack, you're looking at a reduction overall of 12 years. Okay. That's whether you get a heart attack and you have consequences afterwards or not. Getting a heart attack is bad. And then when you look at the risks, there's a 50% risk of dying at 5 years after you get a heart attack. So it's not very good, right? I mean, if you get a heart attack at 55, a 50% chance of dying at the age of 60 isn't a very nice statistic to have. And then when you look at someone who gets a stroke, people often quote like 5 or 10 year survival rates after a stroke. So again, I'm just talking about life expectancy here and why these are important, right? Getting a heart attack or a stroke significantly reduces your lifespan. And then there's the fact of disability and loss of independence. So even in the years that you continue to live, you can expect a significant amount of disability and loss of independence, which is, again, going to affect your overall quality of life. So you live less and you have a less quality of life. When you look at cancer, again, it's the thing that scares a lot of us, and certainly something that becomes more risky as you age. People often quote 5-year survivals. And the reason that I state that is when you get a diagnosis of cancer, your life expectancy has now significantly been altered. You can't even say 5 or 10 years less. You're talking about like how many survive 5 years after the diagnosis of cancer. Okay. And so that's why, again, I'm going to talk about this early detection, early recognition, and then preemptive treatments are going to be very, very useful because you don't want to get to a point where you're diagnosed with cancer. Neurodegenerative, like Alzheimer's, you're talking 6 years survival after diagnosis. So fortunately, Alzheimer's is usually reserved as a disease of aging. And so you usually are, in your 80s, 90s before you develop it. But more important than the 6-year survival after diagnosis of Alzheimer's is, again, this notion of disability and loss of independence. We all probably know someone through 1 or 2 degrees of separation who has Alzheimer's, and it's pretty devastating. And so if there's something that you can do to sort of recognize that and plan ahead of time and then maybe mitigate or minimize the risks of developing this, is going to be important, right? So together, you can see that all of these 4 are, again, what we tend to worry about the most as we age, and rightfully so, right? Like if you look at this data, we are very justified in being worried about these things, in being worried about these 4 things, because it leads to a reduction in lifespan and disability and loss of independence. And so the next question that I ask myself is like, okay, great, you've got the 4 horsemen. We understand now that it's important. Well, what can be done and what should be done? And that's really what I want to be able to focus on today, which is educate, and then in terms of why it's important to think about these things and what do we do. So the first thing, awareness and recognition. So hopefully you attending this podcast or listening to this podcast afterwards or this live stream afterwards, you're going to have some appreciation for this, right? Why we need to worry about it. And the awareness hopefully will be there. And then to recognize that it's important to be looking at these things, that it's important to be trying to identify these sooner than later. Then the next thing you want to do is you want to be able to look at and say, okay, well, great, thanks for that information. Now what's an actionable thing to do? And that is to investigate, targeted investigation and specific testing. And I'll go through what all of this means. And then once you get past that stage, you go look at, okay, so you now go through the investigation and you've identified what you may or may not be at risk for. And so now you want to look at prevention, better, versus treatment. Good, but not as good as prevention, right? And I really break this up in terms of, I try to categorize things. My mind is very categorical. And so I like to sort of go through an algorithm as to how I look at these things. And so when I look at prevention and treatment, you're looking at, okay, well, what can you do from a lifestyle standpoint? And that includes diet and nutrition and exercise and supplements. Right? And then, and then supplements is a second. What can you do to help provide your body the building blocks so that it has the best chance of, preventing some of these things. Medications, medications is important. I mean, you have to embrace the technological advancements in medicine and say, okay, well, some things exist that are going to be useful. Can you use those things to help minimize, again, your risk or treat what you already have, right? And biohacking, which is like disease-specific interventions, using medical technologies like hyperbaric chamber and red light and PEMF mats and things like this to help, again, allow your body to heal. And then the next part after you've done the prevention and the treatment is you want to be able to follow up and monitor, right? And again, this is a big circle, right? So awareness, and then you investigate, then you treatment and prevent, then you want to follow up, and then you investigate, and then you treat and prevent, and then you follow up, right? And so it's this whole thing. And awareness actually is part of this circle, right? And so it's important to keep going back, and you don't just stop at number 4 and say, okay, I'm done, and then never go back to thinking, okay, well, is what I'm doing enough? Have I developed something else new? So let's talk. I'm going to talk about, so this is the framework upon which I'm going to talk about the 4 horsemen individually, okay? And then I'm going to go into specifics. So again, awareness, investigate, prevention, and treatment, and follow-up. So number 1, metabolic, the first of the 4 horsemen, metabolic disease. Again, high blood pressure, diabetes, high cholesterol, hormones goes into that. Identification. What do you do to identify and assess your risk? So testing and screening. I mean, I think that sort of makes sense. It's what a lot of people go into. They go to their doctor and ask to be screened for certain things. And so general things, blood work, really good. Okay? Blood work is good foundation, but it isn't sort of enough. You also want to look at, and the blood work you want to look at is specific. You want to look at your hemoglobin A1C, you want to look at your CBC, you want to look at your CRP, which is an inflammatory marker. You want to be able to look at, your cholesterol profile, both simple like a fasting lipid and more extended like an Lp(a) or ApoB, those kinds of stuff. You want to be able to look at all of these things, okay? What's also going to be important is epigenetics and genetics. Okay, and very briefly, for those who may not be aware of the difference between epigenetics and genetics, essentially genetics very quickly is imagine a novel that's being written or that's been written that has just a bunch of letters but has no spaces and no punctuation. Okay, it's just a whole bunch of sequential letters. That's genetics, right? That's your DNA. Epigenetics essentially is how those letters are grouped, okay, and read to make some type of reasoning, okay, or logic. And so it's important to do both, okay? So genetics was really big in the 1990s when we unlocked the human genome, but epigenetics is more important because it's how that human genome is actually read, and that's important. And to get your epigenetics, screen for, what's your risk of blood pressure, what's your risk of cholesterol or diabetes. The other thing that I have personally began to really embrace over the last several years is wearables. And so it's important that you don't just rely on your doctor to check your blood pressure. I mean, the power of monitoring your body state is now brought into the home with consumer-grade wearables, things like the iWatch. I recommend a lot to patients, Fitbit, other wearables in terms of tracking your steps and your sleep. So these are all really important. Okay, so once you've gotten to the point where you've now sort of assessed your risk, then you move on to the next step, which is, prevention and treatment. Okay, so prevention I sort of left here. Prevention. assuming that you don't have the problem, right? Like assuming you get screened and you don't have diabetes or you don't have high blood pressure. Okay, so now what do? You want to make sure that you have a plan to then be able to follow through on so that you don't get this problem, right? So you want to be able to prevent the onset. I think that's important, right? If you don't have diabetes or you don't have high blood pressure, how do you prevent you from getting diabetes or high blood pressure? And then you want to be able to also prevent the subsequent consequences, right? So you want to be able to prevent the consequence of diabetes like kidney failure. You want to be able to prevent the consequences of high cholesterol and high blood pressure, which is usually heart disease, right? You want to be able to prevent consequences that will directly affect your quality of life, okay? And that's important because it means that you, as a person, as the individual who cares about this, you have to actually do something. Okay, and that's really important. I'm going to touch on that again later because it is vital that you play an active role. Now, assuming you do that identification and risk assessment and you actually do have some of these problems, like you may have borderline high blood pressure, you may have diabetes, you may have some borderline cholesterol, hormonal imbalance, what do? And so you want to be able to create a plan of how to then treat whatever it is that what metabolic problem that you have. And so I usually break it down again very holistically, with the first one being lifestyle. Okay, and so lifestyle, what do? You know, obviously you could already imagine that that's going to require some degree of physical activity and exercising, right? I mean, I don't think that this is anything groundbreaking here. And so, you know, you want to be able to make plans of things like tracking your steps, you know, the intensity. You want to be guided through aerobics and weights and resistance. And so those are important in terms of treatment. Intermittent fast. And so the next one is going to be diet. Right? Under lifestyle is going to be diet. So things like intermittent fasting, the kinds of diet you want, vegetarian, low fat, you know, ultra processed foods. Of course, what I mean is don't eat ultra processed foods, you know, fatty foods, that kind of stuff, right? Mediterranean diet, good, DASH diet. And then there's the biohacking, which I touched on earlier, which is like, can you use technologies to help the body sort of heal? Right? You want to be able to provide it with the building blocks through exercise and through proper nutrition and diet. And then you want to be able to stimulate it to be able to heal. So things like, you know, hyperbaric chamber, red light, sauna, cold plunge, those kinds of stuff. I put sleep in here because I have, over the last few years, realized the absolute importance of sleep. I mean, from an evolutionary standpoint, we have to sleep. Like, we get sleepy. Okay, we have this thing called a circadian rhythm, and certain parts of the day, you get sleepy. And your body wants to sleep. And when you don't sleep well, your risk of developing these metabolic conditions and everything else, actually, every one of the four horsemen, significantly increases. So sleep is a very important thing that you need to be able to track and treat. Then the next thing with treatment is supplementation and IV vitamins, right? Again, the whole idea is, in addition to your diet, is that you want to be able to give the body the building blocks to be able to heal, right? And so things like NAD, glutathione, which is a free radical scavenger, taurine, L-glutamate, and IV vitamins. All of them sort of have a role. Okay, and the idea, again, is to be able to provide the body with the building blocks. And then there's medications, which I've already said before, right? Like these medications, we shouldn't look at medications as like bad. You know, and I know some people out there that are like, bad medicine, I'll take all the supplements you want, but I will say no to pharmaceutical drugs. And I'm just like, you know, you're leaving something on the table. Right? It's just like my other sort of patients who say, I'm only going to take drugs, but I'm going to eat whatever I want. You're not allowed to tell me what I can or cannot eat, but you can tell me what drug to take and I will take those drugs, right? That doesn't work either. You got to really look at it for more holistic and say like, you got to do it all, right? And so you want to be able to hit this target through multiple ways. And so medications, things like semaglutide and tirzepatide, which is like GLP-1 agonists, these little peptides, that's more commonly known as things like Ozempic or Mounjaro. Metformin, statins, peptides. Again, the idea is use what is already available to really help you. Right? And then another part that I think is really important is this idea of weight loss, because fat tissue is very inflammatory, and then a healthy gut. So there's a huge amount of research going into gut microbiome and the importance of having a healthy gut on being able to maintain not just a healthy weight, but a healthy overall balance in your body. So that's treatment. Okay, so that's if you've had these problems already, and you can see how some of these can be put into prevention as well. Like, of course, when you're looking at prevention, you can look at healthy gut and diet as preventative. And then the last part is going to be, okay, so for the metabolic, like diabetes, high blood pressure, and cholesterol, is like now, okay, you've instituted these things, you have to continuously monitor. Okay, so, you could look at things like a CGM, which is a continuous glucose monitor. You can do, again, periodic blood work or regular blood work. You want to be able to follow the vitals either with your physician or practitioner or at home through things like wearables, like Fitbit and iWatch, Oura Ring. Oura Ring and 8 Sleep particularly, they're great for monitoring sleep scores, okay, and how well you sleep. Okay, so again, the idea is, and this framework is the same for all 4 horsemen, okay? You've got the 4 horsemen, okay, and so you want to be able to tackle these individually. And so the first horseman of metabolic disease, this is how you approach it, okay? The second, cardiovascular disease, again, very, very similar. And I really, the reason that I present it this way is not because I'm simple-minded, although I am. It's more because it helps to frame things for me and for my patients so that they know how to attack things in a certain logical way, okay? And so heart attack and stroke, okay? Assuming, of course, that you have had already a heart attack or a stroke, you really want to be able to identify and risk, okay? If you already have had one of these, then we already know your risk. Your risk is very high. And I touched on it initially. But if you haven't, you want to be able to look at, again, blood work. But blood work is not enough, right? But blood work does play a role. You want to look at things like your CRP, which is your inflammatory marker. You want to look at things like your cholesterol profile and your extended cholesterol profile. But in addition, you want to look again at your epigenetics. And see, I'm not talking about genetics here. I'm talking about epigenetics here only, right? So again, you want to be able to see how is your body being read from a genetic standpoint that would increase or decrease your risk of developing heart attacks or stroke, right? And then there's other things that you may have heard about, right? Through friends or family, or maybe you've had it yourself, or your doctor's told you. CTs, cardiac-aided CTs or coronary CTs, echocardiograms, electrocardiograms, vascular studies, VO2 max. All of these are tests that are potentially, not necessarily all useful, but potentially useful to be able to give you as a person, as an individual, an idea of what your risk of developing cardiovascular disease is. Okay, and so once you've established that, then you've been able to say, for instance, are you low, moderate, or high risk? You've got a 5% chance, 20% chance, 50% chance, 80% chance of developing heart disease. Then you want to go into prevention. Okay, again, the same idea. You want to prevent the onset, and you want to prevent the consequences. Right, because again, you want to be able to preserve your overall quality of life, and you want to minimize disability. Next, you want to look at treatment. So treatment can include whether you have the problem already. Let's say you get one of these scans like a cardiac CT, and they do find some heart disease in there. Okay, your calcium score is a little bit high. They see some plaque, but you have no symptoms. Or everything looks clean, but your epigenetics suggests that you're high risk. Okay, so same idea. You're at risk. What do you do? Okay, or you have it, what do you do? Again, I break it down, okay? So treatment is a very holistic approach. Lifestyle, exercise, same idea as with metabolic disease. Diet, things again. You'll see me sort of repeating the same things, and hopefully that helps give people the idea like, ooh, there's some low-hanging fruit here. And the low-hanging fruit tends to be like exercise, which is very common for all of the four horsemen. Diet, also really important. Sleep, also really important, right? Those are sort of like the low-hanging fruit that you could say, if you did these three, I mean, they're good for all of them. They are applicable to all four of the horsemen. Okay, biohacking, again, using technologies to see if you could help sort of stimulate your body to heal. IV vitamins and supplementation, again, specific for cardiovascular disease. You're looking at, omega-3s, coenzyme Q10, magnesium, as part of the electron transport chain, L-glutamate, resveratrol, and then again, some IV vitamins. Okay, the idea is identify your risk and then give you a supplement or the building blocks that is specific to address that risk. Okay. Medications. Okay, should you be going on an aspirin or some type of blood thinner? A cholesterol pill like a statin, metformin again, and again the GLP-1 agonists like your semaglutide or Ozempic or tirzepatide like Mounjaro, right? Dapagliflozin, which is another diabetes drug that has been shown to have tremendous benefits to heart patients, and then peptides. Again, you're looking at this and you're like, well, the point that I'm telling you about all these things is like, some of you may recognize some of these medications, but some of you may not. The point isn't for you to write them all down and say, go to your doctor and say, I need all these drugs. The point is like, you need to be able to see a practitioner who understands what kinds of medications to give you for certain risks that you may develop. Because otherwise, it doesn't really make sense. I could just tell everybody to go on every one of these drugs, of which, it's arguable whether that even makes any sense. But of course, that would be a huge burden, right? Not just a financial burden because you got to take all these pills, but also like, a financial and a physical burden of having to take all these pills. Then there's weight loss and certain procedures that can be done for cardiovascular disease. Again, so imagine you don't have any symptoms, but you get a scan, and the scan shows a significant blockage in your heart. A procedure may be that you get a stent so that it will reduce your risk of developing a heart attack in the future, for instance, right? And so that's why I think it's important to screen. And then once you've instituted some or all of these, then you want to be able to monitor your progress, right? Are you making benefit? Are you making headway? And that's through like blood work, repeat epigenetics, further imaging or other investigations. And again, I say it, wearables. Okay, and so again, very, very common themes, especially a lot of overlap between cardiovascular disease and metabolic in terms of the recommendations, because they are very related, but still really targeted, right? And so it's important to treat them separately, but understand that there are some common denominators there. So cancer, you can see that this is a little bit shorter because it's a little bit more challenging, right? And so cancer, a lot of us, I guess not all of us, but a lot of us are scared of developing cancer because, we've seen cancer and the devastation it may cause. We've probably all know somebody who was diagnosed with cancer within less than 1 year, they've passed away, right? And none of us really want that, right? Nobody wants that. And so again, identification and risk assessment is very, very important. And that's through, that can be carried out through things like blood work, like tumor markers, and again, other things like inflammatory markers. Sometimes you're looking at other surrogate markers like liver enzymes or biliary enzymes that may suggest that there is some sort of pathology going on and gives you a hint to go and investigate further. Epigenetics, again, very important to help understand what's your genetic risk of developing cancer. And then imaging, things like screening MRIs, things like screening CTs and ultrasounds. But again, you shouldn't get all of them, right? It has to be targeted to what it is that you are at risk for. And so it should be a funnel, right? It should be something that's very broad initially, right? Broad initially, and then it funnels down to become more specific. Prevention. Again, you want to be able to prevent the onset of cancer, right? It's much better to prevent cancer than it is to treat cancer. And along the same lines, it is much better and much more advantageous to treat cancer early than it is to treat it late, right? You look at famous people in the news, Chadwick Bosworth, Black Panther actor. He died from colorectal cancer, I think around the age of 39, right? And so look at these things, right? If you catch it early, he would have been able to potentially just get it removed. It wouldn't have spread. Maybe he got prophylactic radiation or chemotherapy, and then you're going for cure, right? Much better than catching it at the end. Same with Steve Jobs, right, with pancreatic cancer. Treatment. So this is predominantly treatment of not so much of cancer, but I guess if you do have cancer, then yes, you want to go for treatment. But treatment so that you minimize your risk, right? And I'm very cautious to say take away your risk, because nothing actually takes away any risk, but you want to be able to minimize your risk so that if, in my own mind, what gives me peace is to know that I've done everything that I can, and if I still get that problem, there's nothing else I could have done, right? So if I live this, if I exercised regularly and I ate well, mostly vegetarian diet, and I was supplement well, and I did all the right things, and I still get a heart attack, I can be like, well, there was really nothing else I could have done, right? And I can accept that more than if I did nothing. And that's the whole idea here. So again, for cancer, what can you do? You can consider things like an anti-inflammatory diet. What does that actually mean? Certain kinds of foods like nuts and milk are pro-inflammatory. Mediterranean diet, rich in olive oil, olives in general. Lots of fruits and vegetables. DASH diet, whole food diet. Biohacking again, the idea is, can you use technologies to help, again, your body heal? And things that I find is really important that's coming up in media now that we've sort of been talking about for a long time, but nobody really paid attention, which was the consequence of plastics, right? Avoidance of microplastics, avoidance of processed and ultra-processed foods. What's very interesting is that there's more and more studies coming out now, probably within the last 4 to 5 years, that have linked the ingestion of ultra-processed foods and death. And so we know that the people who eat more ultra-processed foods, so, the classic example would be your potato chips, their life expectancy is significantly reduced. And that is likely because it correlates to a higher risk of developing one of the 4 horsemen. Okay, so we know that certain foods can increase your risk of cancer, like red meat and colon cancer or colorectal cancer, and so we really do need to pay attention to that. And then exercise, again, very common theme. People who exercise more, to a certain extent, they do reduce the risk of developing cancers. And then you want to be able to supplement your body to be able to fight off, because, the thing with cancer is that may not be well known, is that there's probably cancerous cells in our body all the time. It's just that the body has so many checkpoints that when some cells that could potentially become cancer show up because of mutations or mistakes that happen during replication, the body will go in and eat it up, okay? And it will cause it to die. You or we can support this process, right? That's why right now a lot of the cancer companies out there are talking about the next sort of area of focus for the cancer companies is immunotherapy. And immunotherapy essentially is can we stimulate the body's immune system to go and fight cancer? And the answer, of course, is yes. And so you want to be able to provide the body with the building blocks, again, to support itself so that it can heal and it can go out and scavenge and continue to survey its own body and then, attack the cells that may potentially cause harm. Functional mushrooms, I'm a huge believer of functional mushrooms, things like reishi and lion's mane for different reasons. And so I do believe in that in addition to, your fruits and vegetables. Then, of course, in terms of cancer, there's medications, less medications that you can take that actually prevents cancer. But certainly if you have cancer or propensity to cancer, there may be some medications to consider. And then, of course, if you have cancer, surgery, chemotherapy, radiation therapy. Right? And then again, after all of this, in terms of treatment and prevention, is you want to be able to monitor. All right? You don't just say, okay, I did this one test, I'm good now. I'm not, I now know my risk of cancer. I've made these changes and that's it. You want to, again, go back to the feedback, to this circle. You want to close the circle off and say, okay, well, now that I've instituted these changes, what's my risk again? And you monitor it periodically through things like tumor markers, which is blood work, epigenetics, imaging. Okay? Because you always want to remain proactive. And the last of the four horsemen essentially is Alzheimer's. Neurodegenerative disease predominantly represents Alzheimer's. And so identification risk, this is much more challenging, right? And this is an area of hot research currently, is like how do you predict and identify somebody's risk of developing Alzheimer's? And then the next question is, okay, now that you've predicted the risk, what can you do, right? Those are important. Because it becomes less useful to be able to predict what your risk is of developing a disease if there's nothing that you can do to alter the course, right? Like, why would you want to know if you're at risk of something when you know that there's nothing that you can do, right? My argument has been in the past, like, I probably wouldn't even want to know. But the fact is that now there are some things that we can do, right? And so again, when you're looking at assessing your risk of Alzheimer's, you want to look at specific testing, blood work, biomarkers, specific biomarkers like tau markers, brain scans, or other sort of investigations like scanning. And then there's some memory tests that may play some role in the detection of early memory loss, but harder to know whether that memory loss is then because of things like Alzheimer's, or is it another kind of sort of dementia or cognitive decline. All right, but still important to be able to sort of track over time. Then you want to do like prevention of onset and again of consequences, like what can you do? And then the treatment, right? And so the treatment, again, common theme, right? Diet, very important, but again, a little bit different than the diet that you may be looking at if you had metabolic, right? But again, some overlap. So the good thing is that when you're looking at a plan, right, to address the four horsemen, you're not looking at four different diets, right? So the hardest thing is like, okay, well, you're at risk for diabetes and high blood pressure, and you're at risk for heart disease, and you're at risk for Alzheimer's, and you're at risk for breast cancer, and now you have to go on four different diets. And you're like, well, I don't even know how you do that. You can eat, your limitation on what you can or cannot eat is going to be so great that it's going to be very hard to comply. But so you can see that there's a very common theme: anti-inflammatory diets, Mediterranean diets. Again, exercise. The kinds of exercise generally that you're looking for that's helpful in Alzheimer's is also helpful for metabolic disease. So things like walking, Tai Chi, resistance training, all very helpful. Healthy sleep. Talked about it originally. It's really important, again, to make sure that you sleep well, right? Because when you sleep, that's when your brain forms long-term memories. It's when it takes your short-term memories that you had in the day, and then it puts it into a long-term memory so that you can recall it later, okay? Really important. So people who sleep poorly, you're going to be at risk of neurodegenerative disease like Alzheimer's. You're going to be at risk for heart attack and stroke. You're going to be at risk for metabolic disease. And probably you're going to be at risk for developing cancers. And things, again, like biohacking, which I've touched on. Important vitamins and supplementations, again, functional mushrooms, other supplements such as ginkgo and omega and vitamin E and B12, all very important in order to be able to support the nervous system and the brain. Medications. Okay, there are some medications that you can be looking at taking that would be specific if you had like a specific kind of problem to reduce your risk of Alzheimer's. And then what's more important actually is the avoidance of some medications. There was a recent study that just came out that actually showed that certain anticholinergic drugs that are very commonly used in things like bladder spasm or antidepressants or antipsychotics that people tend to use, like practitioners tend to use for sleep, because they have an anticholinergic property to them, they actually increase your risk of developing Alzheimer's or dementia in the future. Okay? And so the avoidance of some of these medications is going to be as important and probably more important than medications to help reduce your risk. Brain stimulation and exercising. I'm not talking about like direct brain stimulation through electrodes. I'm talking about brain stimulation through things like brain exercises and puzzles and thinking, right? And brain training. And then there's the importance of avoidance of excess exposures to things like different common metals, right? Like copper, lead as well, and aluminum and iron. And so all those things. And then once you do institute that, you want to be able to make sure that you continue with the monitoring, and follow up in terms of memory tests and brain scans and imaging. Repeat blood work has less utility. Okay, so blood work, there isn't really a blood work that you can find to say, okay, you've identified that you're at risk for Alzheimer's, you've made these changes, you've made these supplementations to help reduce your risk. Then you can't do blood work again to see if it's worked. Okay, that's the unfortunate part about Alzheimer's right now, is that this is an ongoing research, and I don't know of any personally of ways that you could follow blood work to see whether you've actually reduced that risk. Like cholesterol, okay? You go on a cholesterol medication, or you make these changes through your diet and your exercise, and then you can check your cholesterol before you did it and after you did it, and it went down, you're like, good, right? There isn't something like that for Alzheimer's yet that I'm aware of. Okay, so now that I've sort of told you all that stuff, and you say, okay, well, what can I do, right? And hopefully this is clear. Hopefully, again, I've given you the reasons that you should care about this. Right? And you're here, you're listening today, or you're listening to this after today, and because you care, you want to, you have some appreciation of the importance of this 4 horsemen. Okay? Again, because you don't want to die prematurely if you can, right? Or you want to live the best that you can. So again, the most important thing, the first step is going to be awareness and recognition of risk, right? And I've talked about that with all the 4 horsemen. Early identification or detection is the best, right? I am a firm believer of preventative medicine. Preventative medicine is much better than reactive medicine. I would much rather see people before they have a problem rather than after they have a problem. For those who attended my menopause talk, I'm going to give you an example. In my menopause talk, I talk about the weight gain issue, right? That goes through perimenopause and menopause. And on average, women gain 1.5 pounds a year. And if menopause lasts for 8 to 10 years, you're looking at 12 to 15 pounds of weight gain. Now, I can tell you that it is way easier for me to be involved with the perimenopausal patient early in perimenopause or before they hit menopause, and then help them through those 10 years in terms of just their weight, than it is when I get them afterwards where they've already gained those 15 pounds, and now you're trying to balance everything, and that weight is stubborn. It doesn't want to come off. Okay? It is way, way easier to get people and treat people before they have a problem. And I'm not just saying that because I want an easy job. I am saying that because it's better outcomes. It is always better for you as a person to prevent having heart disease than to treat the heart disease. And so what else can you do? So, I mean, you're here. I'm with Ageless Living. And that's what I want to be able to share with you. And so what I think is the best way to seek help, okay, to address the four horsemen is I think you need to choose a practitioner who is knowledgeable and who really, I think, works with a team. I'll be the first to admit I do not know everything. And I don't think it is possible for me to know everything. There are some people out there that are just really smart and they maybe can know everything. But even then, I would argue that it's still better to have a team-based approach. And so that's how I practice. I lean on my team of other practitioners to be able to provide patients with a holistic and multidisciplinary care. So the services that we offer, things like hormone optimization, the longevity program, which looks at directly much more intensive, treatment of like the four horsemen, medically supervised weight loss, healthy gut, which I talked about, how important that is, IV vitamins and customized personal vitamins, vitamins that are necessary for your body, not your neighbor's body or not your sibling's body, biohacking and medical aesthetics. All of this sort of in one house, in one uniform facility to be able to provide you with comprehensive and a unified plan. Okay. And then the last thing, and I think this is the most important, and I think it is the hardest thing for people to do, and that is that it requires you, if you care about the four horsemen, if you care about addressing the four horsemen in your life, you need to be an active participant. All right, and I'm gonna go off on a little tangent here and be a little philosophical, but I think it's important. The way that our healthcare system has evolved over, at least in North America or Western medicine, in the last probably 100 years, is that patients have been convinced that they don't need to be active participants. You go to your doctor, you go to your practitioner, they give you a pill, you take the pill, you don't question them. If you do, some of them are okay with it, but most aren't. But the fact is you take a pill and you do what your doctor says. You go do blood work when they say, you do whatever they say. There's no role for you. You just do what you're told. That's not the way that healthcare should be delivered, at least not in my view. And in my view, the best healthcare has to be co-management. You need to go to a practitioner and you need to say, and it needs to be an open conversation. You need to be participating, okay? There's no pill that will simulate exercise or replace exercise. There's no pill that will replace your diet. Again, I have patients that tell me, I will take your pills, but I will not listen to your diet recommendations, or I will take your pills, but I will not exercise. And that's you're not going to get a full experience, right? And so again, you need to take control. You need to be active. And so this is generally just a big slide to show who we partner with. And so I've got people that like try to do this themselves, and they try to go get testing themselves, and they want to just be their own pilot, and that's okay. I tell you, it's pretty complicated, but there are no shortages of suppliers out there who will try to entice you to buy their test in order to give you some information that you're not sure what to do with. And so, here at Ageless Living, I've vetted the vendors that we use. I think there is a reasonable law, or their tests are reasonable in terms of what information they provide and what actions I can then take with the results. And so this is them. And I'm going to move into some FAQs before some questions. All right. So the first one, what are the advantages of this type of preventative care? I get asked this a lot. It is always, like I mentioned, it is always easier to treat something before you have it than when you already have it. I actually forgot to include a slide here that I wanted to sort of show this sort of propagation. When you look at like the propagation of like an inflammatory cascade, or you look at the propagation of, say, anything that spreads out, like diffuses out, right? So if you could imagine this event that happens and then it spreads out like this, it is much better to control this before it fans out over here where it's narrow than out here where it's really big and diffuse. And that's the idea of preventative care, right? Actually, that's the idea. I gave an example here of prevention of stuff that we do day to day that's outside of our life, like a roof. It's better to fix your roof before it leaks than afterwards when it's already leaking. Okay. Same as maintenance of a car. I know some people may not believe in maintenance of a car, but that's a different story. So, but the idea is prevention will always outweigh treatment of like reactive medicine. For Canadians, the next question I get asked commonly is this available through provincially funded system? And the answer to that is unfortunately not. And even in the U.S., I'm not as familiar, but I know some things about the way that the U.S. system works, is that a lot of the times it's also not necessarily covered. Although I'm going to touch on that a little bit more in a bit. But in Canada, the way that our current healthcare system is set up is that it's really set up to be reactionary. It's not set up to be proactive. There's reasons that I postulate why that is the case, but it's really not. You can't just go to a doctor and say, I feel great, and I want you to screen me for stuff because I want to stay feeling great, and they're just going to look at you and not do anything, okay? It's like you got to convince them, my sister died of cancer when she was my age, and so did my other sister, and so did my aunt, and her sister, and my mom. And then they say, fine, okay, I'll screen you. But generally speaking, it's very reactionary, like, oh, you have a lump in your breast? Okay, fine, let's investigate that, okay? In the U.S., a little bit different. Not a lot, but a little bit different. And it's only one potential reason. I'm not saying this is the only reason, but one potential reason is that in the U.S., with a for-profit medical system, the health insurers realize that, hey, if I can prevent something, then it actually costs me less money than it would if I tried to treat them when they already had that problem. Okay, so that's why it's a little bit different, but even still, it's hard. And so all of our services, unfortunately, because of this, is private, including all the testing. A question that I get asked, maybe less frequently, but certainly a question that I ask myself all the time, is that if prevention is so cost effective, why isn't it covered? Right? I've touched on that answer a little bit, or that question a little bit, when I talked about the U.S. and their for-profit insurers. But in the Canadian healthcare system, I don't know the true answer. And I'm not sure that anyone actually knows the true answer, because it's probably not just one answer. I can postulate, and again, these are just my opinion, and I'm postulating on potential reasons why. One is, and the reason I say this is because I've seen this over my 14-year career so far. One is it's political, in that policies get made based on political cycles. In the U.S. it's 4 years, in Canada it's 6 years. If you got 2 terms, it's double that. And so oftentimes preventative care does not align with the politician's goals. Okay, and so it's hard when you as a politician, institute a change of prevention, and then it's your successor who gets to claim victory. Okay, that's one. The second is that, again, it's political, is that the cost of prevention is large upfront. Right? Just imagine all the people, if you have to screen all these people for diabetes and high blood pressure and heart disease, and then, you're going to prevent things in the future, there's a huge upfront cost that you now have to pay for now. If it was a single payer system with a single leader, then it would be easier to justify that, because you would say, okay, well, I'm just going to, I could pay up the front now, but I'm going to save that money in the future. Right? I still have to make the money both ways. But again, in our system of revolving leaders, it becomes less ideal because it creates, hard things like deficits now. The other thing is that, and this is, I'm not really blaming the patient, but again, I'm blaming the system, is that the prevention you can't do in a pill. What I mean is it's hard. It takes work, right? To do preventative medicine on the 4 horsemen, to prevent the onset of any of the 4 horsemen, it requires work. It requires work from you to seek the professionals that need to help you, and to do your own research. But it also requires work for you to actually make those changes, right? It requires effort to not eat those chips or that junk food or all those pastries or all those things like refined flour or or the white rice, right? It takes work. And that's hard. And I think people like the idea of prevention until they actually have to try to do it. And I think a lot of people previously used to fall out. And it was because of that. So that essentially concludes the bulk or the meat of my 4 horsemen presentation. Again, just to summarize, I should have had a summary slide here. I just realized that. To summarize, the 4 horsemen, they represent, let me go back to the very beginning. Okay, so here. The 4 horsemen, why are they important? Because it represents 80% of the deaths of people above the age of 50 who don't smoke. Okay? So it's the biggest cause of people dying when you get over 50. And they are metabolic disease, like diabetes, high blood pressure, high cholesterol, hormonal problems, cardiovascular disease like heart attacks and strokes, cancer, and Alzheimer's. Okay? And each of these not just increases your risk of death, but they can lead to disability. So those are the important points. The other points is there's a systematic framework that you can work with to understand and recognize your risk, and then institute a plan to reduce your risk. Okay. Okay. So the as part of the this talk, and in preparation for the holiday season coming up, we are offering some holiday specials. Give the gift of health is what I call it. And so for those who are interested in getting something, after this talk for, either themselves or a friend or a family member, we do offer what I would consider 5 specials to help get you in to addressing your 4 horsemen. Okay, one is an epigenetic analysis. So for $14.99, you can get an epigenetic test and a consultation to review that and to be able to understand where you stand in terms of your risk for your 4 horsemen. You can do nutritional analysis, which again looks at an epigenetic test for your nutritional testing for where you are nutritionally, and then you get a consultation with a holistic nutritionist and gut expert. I forgot to tell you, the epigenetic test for $14.99 is very interesting because it also gives you your biologic age, okay, which is different than your chronologic age because, for those who want to know, I can talk to them about it separately. We also have a gut reset program for healthy guts, okay, which includes all the testing and the consultation, but not the cost of the actual treatment. Weight loss, we've talked about the importance of weight loss, how fat is very inflammatory. So we do offer a special weight loss program, medically supervised with, using the GLP-1 agonists like semaglutide or Ozempic and Mounjaro, and, looking at which one is the most appropriate. For instance, as an aside, the studies suggest that Mounjaro makes people lose more weight. Okay, so on average, Mounjaro can make people lose about 30% of their weight, up to 30% of their weight, and Ozempic maybe about 25%. And so, medically supervised weight loss. And then we can also do, for those who are local, we can do some customized personalized vitamins and comprehensive nutritional analysis for $1,250, which includes the lab test and the consultation. Okay. Actually, you don't have to be local for this. This one can be shipped out. But again, the idea is to be able to get a nutritional assessment of your nutritional status, and then be able to custom make a vitamin that will replenish what your body is missing rather than a generic multivitamin. So that's the end of my presentation. So, ready to take control. If you're interested in learning more or have any or want some additional information, you can either call us at this number, email us, or visit our website. So that is it. And so I am going to move into questions. I'm going to leave this up here for a sec. And then we'll go into, are there any questions?
All right, so our first question is, how does VO2 max identify risk?
Yeah. So VO2 max essentially is like a supercharged stress test. So if anyone's ever done like an exercise stress test, it looks at not just your ECG or your electrocardiogram in terms of your cardiac functional status or your heart functional status, but it also looks at how well your oxygen is exchanged. And so all of that, there's been studies that have shown that high VO2 max or optimal VO2 max, and there's some age groups, reduces one's risk. And so we know that essentially you could think of as a VO2 max as giving you an idea of where your physical fitness level at a cellular level is. So if it's very poor, we know that that's going to increase your risk of developing things like diabetes and high blood pressure predominantly. Now, whether it increases your risk of things like cancer, probably not, but it gives us, again, an idea of where your functional or your fitness level is, but from a cellular level or more from a cellular level.
How do microplastics affect your health?
Yeah, that's a good question, and certainly something that I've been very keen to try to understand myself. So we know that there are more and more studies out there that have looked at the prevalence of microplastics in all of our bodies. I mean, we're finding it in every part of our bodies. And they're noticing that, for instance, there was a study that came out that said that it was found in post-autopsy in, I think, 7 out of 8 penis. And it does, and they postulate that it does affect things like fertility. And so the idea is that these microplastics, they get into our system and they stay there, and they can affect things like your hormones. So you can get hormonal imbalances. It can potentially affect your nerves. And certainly it affects the way that your body functions in terms of the balance and what's called homeostasis.
In my family of 4 siblings, 2 have had cancer. Our doctor recommended genetic testing for the other 2 to see if there is a genetic risk. How accurate are these tests?
Yeah, so without knowing the actual specifics, I think the answer is they can be quite accurate. And so, for instance, there are some cancers out there that are genetically linked. And so if you test, the people in the family who have who have cancer for a genetic mutation, and they are carriers of this mutation, and you can test the family who are unaffected to see if they're a carrier and therefore determine their risk, right? And so this is something like, to give an example that's more clear, which is like the BRCA gene. And the idea is that, so in that instance, it can be. But in an instance where, for instance, the family members have different cancers that seem to be unrelated, it's much more hit and miss. Okay? And so the short of it is it may be accurate, but it may not be. And it depends.
We have a follow-up to the VO2 max question. It says, I'm a 78-year-old male. Is a VO2 max of 150 considered good?
Yeah, so I'm not going to be able to provide any assessment on air for that kind of things. I think, I'm not going to be able to provide that kind of answer, because there's more to it than just that, and it wouldn't be appropriate for me to provide medical advice or an assessment on a singular reading. Sorry. So thank you, everyone, for joining us. I lost track of time. I thought I was under time, but it looks like I'm over time. And so stay tuned for our next podcast in this series, or next live stream. I'm really excited to present more topics. If anybody wants a topic to be discussed, send us an email through our website, and we'll put something together.